Mr. Speaker, my first maiden speech that I delivered a year ago, I provided a brief overview of the health status in this country, and in that speech I also briefly highlighted the current status of malaria and non-communicable diseases, and further touched on essential medicines and supplies and health infrastructure and health workforce. Mr. Speaker, I will update this Honourable House in response to the speech from the throne, and I will briefly present some of the Ministry's efforts in responding to the policy priority of GNUT, and also to briefly highlight some of the achievements and implementation of the Ministry of Health and Medical Services to date. Mr. Speaker, when I was given to be the Minister of Health, I have continuously advocated for 4 basic foundations of driving a good health care system. Mr. Speaker, we need to have a good health governance, improved health infrastructure, and a sustainable medical supplies. And also, we need to have willing and passionate health workforce, that they have the passion to save our health system, delivering healthcare services that our people need and deserve. Mr. Speaker, for medical supplies, as alluded by the Governor-General, for the first time after so many years, the Government of National Unity and Transformation has increased the 2025 budget for the national medical stores dramatically from the 41 million in 2024 to 125 million in 2025. Within the National Medical Stores budget, the subhead drugs and dressings has increased from 31 million in 2024 to 95 million in 2025. This is an increase of 67.2%, Mr. Speaker, in this year's budget for medicine and dressing subhead for the Ministry of Health and Medical Services in 2025. Mr. Speaker, to date, the Ministry has expended 28.8 million SBD of the 95 million allocated for drugs and dressing to settle our long overdue outstanding bills to our creditors and suppliers, while at the same time we procure new supplies to cater for the increasing health needs of our growing population. In terms of our medical supplies, 3 shipping containers have been received for the first quarter of the 2025, and comes to June, the Ministry is expecting 12 full containers, and we will increase from our percentage from 59% to 87% with our M supplies. Mr. Speaker, when I took office, the percentage of the M supply has sold 59%. Now we are increasing to 87%. In terms of our stock availability, I am happy to report that the availability of our critical items at the National Medical Stores has now moved, as I said earlier on, 59% when I took office in 2024 to 87% since the beginning of 2025. Mr. Speaker, in that period of June in 2024, when our percentage is 59%, the availability of our critical items is very low. And Mr. Speaker, our medical and clinical workers would realize that medicine availability at our health facility become an issue and always out of stock, affecting the lives of our people. And the good news, Mr. Speaker, we have gone past this. And as I speak, the percentage of medicine stockpile availability is increasing from the 59% to 87%, and hopefully it will go up to 90% June this year. Mr. Speaker, I'm also pleased to report that for the 2025 and 2026 annual drugs and dressing tender cycle, the National Medical Store has completed its quantification and clinical consultation exercise with the various heads of department and programs of my ministry, and therein will proceed with a tender on June 2025 and is set to start receiving the medical supplies by the last quarter of 2025. Mr. Speaker, for the health governance in our efforts on ongoing legislative and policy changes for the delivery of health and medical supplies to ensure all individuals access quality healthcare services, the Ministry of Health has progressed its policy review of the Health Service Act of 1988. A series of consultations, total in 10, Mr. Speaker, have already been conducted, and the last round of consultation with our key line ministry, Ministry of Finance and Treasury, Ministry of Public Service, and Ministry of Provincial Governance, is scheduled to be conducted early next month. Upon completion of these consultations, the Ministry would like to finalize and progress the policy document towards drafting part of it. Mr. Speaker, the Ministry has also been heavily engaged with key partner ministries with a review of the Dangerous Drug Act, which is outdated. The first one, Mr. Speaker, was developed in 1941 and amended in 1970, has no significant updates since then. Thus, this poses a risk that the enforcement agencies need to rely on its overseas counterparts for its enforcement purposes. The DDA review is important due to the proliferation of new illicit drugs, risks to personal health, disease transmission, and national security. The Act also involves at least 2 ministries, therefore the need to review, implement, and enforcement from a governance perspective. Our legislative work that are in various stages of development that may before this Parliament are the review of the Pharmacy and Poisons Act, the National Council Act in policy review at this stage, Mr. Speaker, and the Medical and Dental Practitioners Act. Some of these laws may only need amendments, while some new complete laws that be needed. The review of the Principal Health Law, the review of the Health Service Act is paramount in the sense that it can provide an overarching legal framework for other health-related laws. Mr. Speaker, me must tell him that without a good governance, by me always garam or the issues of the health services law you may. So you must threat them head to you, Mr. Speaker, before other parts of the body have me wakagu. So our Health Service Act is very important, and hopefully I will soon bring it to Cabinet and then come to Parliament. Mr. Speaker, in terms of health workforce, in regards to the Ministry's regular monitoring and strengthening of public health emergency civilians and responses, preparedness efforts, and to update responses capability, my ministry continues to enhance local capacity and capabilities, as this is critical in managing and controlling diseases outbreak. In 2019 and to date, the ministry has upskilled 15 health workforce to undergo epidemiology training program, with another 15 health staff trained and funded under the Pacific Community Postgraduate Certificate in the field of epidemiology through the Fiji National University, while at the same time critical focus to improve on other 25 Sentinel civilian sites in the provinces. The Ministry of Health and Medical Services recognized the need for technical human resources to be engaged in the 10 provinces and in the process of creating positions for health civilian officers in all other provinces. Mr. Speaker, the Ministry has successfully conducted its first ever joint external evaluation in September 2024, beginning in experts from around the globe to assess the country's capacity to prevent, detect, and rapidly respond to public health risks. The report will soon be presented to Cabinet. Mr. Speaker, the Ministry's civilians' capacity was called upon it provided immense support and contribution at the recent regional events that Solomon Islands had the privilege of hosting, and these include the 17th Pacific Games in November 2023 and the Ocean Soniera Summit in February 2025, and will be again engaged in September for the 54th Pacific Forum Leaders Meeting to ensure that the public health risks are prevented, detected, managed and controlled. Mr. Speaker, as part of the Ministry's retention of our health workforce, the investment in training and retaining health care professionals, improving the overall quality of care and work towards creating a more equitable and efficient healthcare system for all is a key policy of the Government of National Unity and Transformation. This is critical as the capacity of health system to deliver health services and meet the changing demands of our care strongly depends on the availability of a workforce. No health workforce, no health system. Therefore, in our efforts to address our health workforce needs, while at the same time addressing our challenges, the Ministry of Health has completed the development of its health workforce strategy 2025-31, with a substantial contribution from our partners and stakeholders, including the provinces. The final phase is for further technical review through a second opinion from an external reviewer to ensure that that strategy is both achievable and implementable with respect to the recommendation set forth in the strategy. Mr. Speaker, the Ministry has invested in training for health staff with a significant increase of 2.5 million in 2024 to 5 million in 2025. This has enabled the Ministry to accommodate and process more applicants from provincial health divisions, national programs and medical departments, and health support services. Training budget is focused on long-term training through in-service and short-term trainings, both local and international, on technical areas. Mr. Speaker, I am happy to announce that the Ministry had progressed the recruitment of 180 nurses and 35 doctors positioned, with the majority receiving their posting to the duty station in the provinces. And also, Mr. Speaker, me also meet with them head of departments or NRHs. Me follow remove him now word casual, as the good opposition leader has recommended in our last debate. We have put what they call fixed term contract. These health professionals will add value, Mr. Speaker, to the current health care services in the provinces, hence improving the quality of care. Mr. Speaker, in terms of our health infrastructure, on the fourth advocacy, on ensuring better health services delivery, Mr. Speaker, through strategically planned and implemented investment in healthcare infrastructure, the Ministry is heavily focusing on this investment. Between May 2024 and to date, major infrastructure development that has been completed, and me like for Talent, expansion and improvement of the National Medical Store, Hemi done, where June 2024 now me launching. Mr. Speaker, the launching of the first country's comprehensive medical center, me launching 2025, Hemi expected for open this June the 2nd. For opening more services, Lohem. There are a few issues surrounding. No good by him. Next question. So we must update him house now that the cable blow electricity now hemi small, so they change it, and then we expected I communicate with the Chief Executive Officer, blow NRH, confirmed that the 2nd of June. Then by Operation Blohem by hemi open, which we will deal with cases of cardiology, where hem blow heart. We will able to do stenting low there, where meaning if you got a heart attack, we will able to do that. Low here for open up dilative now, or the vessels lo heart that block and nimisa of sudden death lo hem. And also nephrology, where deal with kidney, and also urology department by open lo this June. Almost 30 years, Mr. Speaker, the refurbishment and improvement of the Tulavi Hospital me also done. Me launched him lo March 2024. Helena Goldie, me also launched him where me completed, and I want to sincerely acknowledge one of our good MP for that constituency, me fella go attend him, that me launched lo April 2025. And these are some of my advocacy to improving healthcare, health infrastructure, so that effective healthcare delivery by me effectively delivered to our good people of Solomon Islands. Mr. Speaker, civil works is progressing for the Naha Uben Bathing Facility and the Kilufi Hospital improvement. Both these works are scheduled, and we anticipating for launching these two health facilities in 2026. Mr. Speaker, the Ministry have invested and conducted major infrastructure projects in selecting provincial centres over the past 2 years through funding from the development budget, Ministry of Health and Medical Services, where we are focused for improving and constructing over the area health centres and rural area health centres across country, and me also like for updating this Honourable House and with a good colleague, Member of Parliament. One is the construction of Conida Area Health Centre, Level 1 Lo Isabel, Waka Hemi 90% now completed, or the final Waka Noma Hem stop, and me expected for launching this year as well. Second one, Tukutaunga Area Health Centre, Lo Tikopia, construction Blohem, Hemi 98% complete now, and only waiting over the supplies and installment over the machines, Waka, then we should launch him as well. Construction of Manuopo Area Health Centre, Level 1 Lo Refilance, Hemi now equipment Hemi ready, they are already in country, and then Bangal Putungolo Area Health Centre, and then we should also launch this year. Fourth one, Mr. Speaker, construction below area, Wagina Area Health Centre, Level 1 in Wagina, Chusel Province, Hemi already 90% complete. Work Hemi reaching final stage. Staff houses have completed. Only what the minor works have done, and then Bami should also launch him this year. Construction of Dede Rural Health Centre in Isabel Province, Hemi 95% complete, and currently installation of solar and genset no Hemi stop, and Imi should launch him this year as well. Construction of Gonatai Rural Health Centre, Hemi 90% complete as well. Current work, Hemi also for final fittings and solar installation, and then Imi should launch him this year. Construction Leona Rural Health Centre, Lo Vela Navela, Hemi 85% complete. Work Hemi currently ongoing, and final fittings and painting, and should be finished Lo April this year, and Hemi anticipating for launch as well. A renovation of Sulufola Rural Health Centre, Lomalaita Province, 100% complete now. Currently awaiting variation for solar installation and fencing, and then IMI should also launch him this year. Construction of Gorobao Rural Health Centre, Hemi now tendered, Hemi done, award Hemi also done, and Hemi anticipated for starting work this year. Mr. Speaker, you listen to my brief update. There will be nine health facilities that I will launch this year under our very own budget, under the national development, under the development budget of Ministry of Health and Medical Services. Mr. Speaker, through to all my colleagues MPs, I'd like to sincerely acknowledge him for your support in the 2025 budget. Project management is ongoing to ensure these projects are appropriately monitored and evaluated according to the requirements set forth for their completion. To date, most of these projects have reached their final milestone and nearing practical completion with planned handover that by me expecting this year. Ministry of Health and Medical Services is also in the process of conducting other scoping assessment exercise for the improvement and upgrading of all health facilities throughout the country. The assessment will inform budget provisions for funding support under the development budget for 2026 and onward. So, Mr. Speaker, me ask him if 2026 budget come, me like to ask him Chairman, below PAC, for approval now of the increased budget, below development budget for improving all the health infrastructures across the country. This exercise will greatly enhance and support the development of an infrastructure roadmap for Ministry of Health and Medical Services in accordance with the National Health Strategy Plan 2022-31. Ministry has also seen the renovation of Kapu Area Health Center Level 1 ongoing, and Mr. Speaker, I'm finished now, and I am ready for handover upon my return from the World Health Assembly meeting. Me like for taking this opportunity to sincerely acknowledge Tiva for their funding. Additionally, a recently signed health partnership agreement between Australia and Solomon Islands will also see investment for the improvement of health infrastructure in the provinces through its Provincial Health Facilities Fund. So in fact, 10 million now is set aside for this activity. Ministry of Health and Medical Services has embarked on a strategic way forward in ensuring health services are made accessible and available to the rural population by strengthening and developing health facility improvement in primary health care. Ultimately, delivering an impact rests on the strength of local health system, including the strength of the health workforce and the health infrastructure. This year, Mr. Speaker, I'm advocating for the 3 provincial hospitals to budget for upgrade law 2026. They are Lata in Tamotu province, Kirakira in Makira, Kirakira Hospital in Makira Ula province, and Bola Hospital in Isabel province. So I will do the scoping for this year, and they will appear in the budget that by me come in law parliament. Mr. Speaker, I urge through you to my colleagues to support me in investing in health to build national wealth for economic growth. Yes, we can, Mr. Speaker, and I'm optimistic as a Minister of Health to drive this vision forward. Health workers are of course, the backbone of every health system, but the availability of health workers to deliver quality health services also depends on the quality of the health infrastructure and the availability of equipment. Capital investment in facilities equipment and are essential to allow health workers for doing now good job blockade. Mr. Speaker, my ministry stands ready to address 4 major but critical priorities, also me always tell them, the health governance, health workforce, health infrastructure, and sustainable medical supplies and consumable. They are interdependent, Mr. Speaker, and the best health worker cannot deliver the highest quality care if they are working in a facility with no electricity or running water. Likewise, the best health facility is no use unless it's staffed by skilled, performing, equipped with basic and specialized equipment and consumable. The ministry needs a performing and result-oriented health workforce. There is no getting around the fact that quality health care takes investment. Why we must spend now, Mr. Speaker, for improving health in our country. But that's how we must see it, as an investment. But that's how we must see it, as an investment to be nurtured, not a cost to be contained. Mr. Speaker, in conclusion, the journey we have undertaken in the past year has been one of a significant progress and unwavering commitment to improving the health landscape of our beloved nation. Our focus on health infrastructure has led to transformative projects that enhance service delivery, and accessibility for all citizens. The investment made in health workforce development ensure that we are equipping our medical professionals with the skills and resources they need to provide high-quality care. Further, our efforts in bolstering our medical supplies have resulted in a remarkable increase in stock availability, ensuring that our critical health needs are met promptly. The governance reforms we are implementing are designed to create a robust framework that supports effective health service delivery and addresses the evolving challenges we face. As we look to the future, I remain optimistic about the path ahead. The collective efforts of the Ministry, our partners, and this Honourable House will continue to strengthen our healthcare system, ensuring that every individual has access to the care they deserve. I express my deepest gratitude to my colleagues, stakeholders, and the people of Solomon Islands for their ongoing support and collaboration. Together we will build a healthier future for all. To all health workers around Solomon Islands, I thank you for the service you have done, and I kindly ask you to continue to save our people and our country. Let us invest in health to build our national wealth, as I alluded earlier on. Thank you, Mr. Speaker, and thank you to this Honourable House. God bless Solomon Islands from shore to shore, and I wish you all a sound and fine debate in the days ahead. I resume my seat, and I thank you, Speaker.
Thank you, Honourable Minister for Health and Medical Services.